screen. Hi, my name is Rebecca Hall. I'm going to be giving a talk to you on sustainable healthcare and the green impact for health today. I'm going to share my slides with you afterwards. So very happy to share my slides. I will be signposting a lot and covering a rather lot of information. So I'm sorry if I go a little bit too fast, but it's really just to try and get it through in the 30 minutes. I am a GP. I've been working I'm a regular GP. I've been doing sustainable work for probably about 5 years now, having started the Green Impact for Health when I was working in Frome. It aligned very nicely with the with social prescribing, which we were very big on in Frome, and I'll cover a lot of that in the talk. The first thing I want to talk about really is about sustainable health and healthcare and what it is and why we need to do it. The crucial concept of this is the essential part of healthcare is that we do no harm, that the healthcare that we practice today on today's patients is not harming our future generations of patients. I do see this as absolutely crucial, that we think about this in all aspects of healthcare, but I also see it as a solution to the challenges we face at the moment: huge workload crisis and burnout and escalating financial costs of healthcare. And when I say health costs, I mean financial and environmental. It is a bit of a cultural change, though. It really needs us all to make our environmental impact of what we do part of our decision making, whatever level we're doing that, whether we're face to face with the patient or whether we're at policy decision making. Very important to join up with networks, and that's why I've put that on. Just a quick summary of the NHS impact. Currently, 4% or 5% of UK emissions are caused by the NHS, including 1 in 20 vehicle journeys are attributable to the NHS. The direct effects of our climate change or the climate crisis on the UK specifically are mostly flooding and coastal erosion, but there's obviously huge indirect effects. Probably the most pressing one will be immigration, but also societal breakdown. We're going to talk about the impact of the green impact here, and it's about mitigating the CO2 emissions, but also about adapting our communities for the inevitable rises in CO2 and temperature. And because of that adaptation, I just thought I'd show you this area of the country where we are and the likely direct effects of flooding. So you can see here, this is the land projected to be below the annual flood level in 2030, which is in 7.5 years' time. A sobering thought. You can do all kinds of predictions with this at Climate Central. It's a very interesting website. So the NHS is committed to net zero. The commitments are by 2040, they hope to reach net zero for the NHS carbon footprint. Those are the things we have a direct control over. And by 2045 for those things that we have an influence over. I'll go into a bit more here about the different scopes. So the direct impact is the use of fossil fuels, the NHS buildings, anaesthetic gases, which is quite a significant component, and all the NHS vehicles, also the electricity we use, and the travel and the waste waters and meter dose inhalers. Remember, meter dose inhalers are very important. And then on the bigger things that we have an influence over, but we don't actually directly create the emissions, medical devices, medicines, and patient transport. This is another way of looking at the same thing, but it just shows the proportions a bit better. This is from October 2020. Interestingly, there's inconsistencies when we look at environmental impact. Often carbon emissions is the most used figure, but in other, when they're talked about, when environmental impact is discussed, often they are other aspects that are looked at, especially waste, freshwater usage, and greenhouse gas emissions. On this slide, what I'd really like you to look at is the anaesthetic gases and the metered dose inhalers, 5% of the overall NHS carbon footprint plus. So that's the things that we have an influence over. Now, sadly, we don't have an effect on anaesthetic. We can't have an effect on anaesthetic gases, but metered dose inhalers, we really can. And we can do that by guiding our patients to this website, greeninhaler.org. The current metered dose inhalers, salbutamol, emits the same greenhouse gas as a regular car driving from London to Sheffield. If you change that person to a dry powder inhaler, on average, that will reduce the greenhouse gas emissions of that inhaler to minimal from London to another part of London. So this is something we can all do. It's a whole talk in itself, the asthma and the inhalers, and very complex to embed that into an already complicated respiratory management. How are we going to do this then? Well, we are going to, this is how we're going to achieve this. This is the projection of how we're going to get to net zero. And we can see where we are now. We have come down, and if we do nothing, we will stay the same and slightly increase. And these are the things that we can do within the NHS. And there are some of these things that are a bit, well, there are some of these things, but the important thing here is the shift to low carbon inhalers, which is the pale blue one. So we can have a direct effect on that. However, we can also impact at others of these things on the right-hand side. The National Electricity Decarbonisation, we can't affect that, but we can certainly make sure that our buildings are signing up to renewable energy sources. We can also practice affect low carbon models of care, and I'll come and talk about that a bit more. We can also practice preventative medicine and reduced, well, what does that say? Reduced health, not quite sure, but we can practice preventative medicine. So why aren't we all doing something? Well, if there isn't enough time in this talk to give all the information, and what I would really like you to do is to go and watch Terry Kempel's video. Terry Kempel was president of the RCGP about 10 years ago, and he started up the Green Impact for Health, which now several hundred practices have signed up for. This is a link to a 15-minute video, very full of information and a summary as to why we're doing this and how the Green Impact works. And I'm not going to cover so much on the specifics of the Green Impact. There's masses of information in there, and all the stuff that I'm going to talk about is stuff that I've got as a result of doing the Green Impact, and it sends you off in all kinds of interesting therapeutic directions. But this is an important slide. This is the carbon footprint of the NHS in 2012. And what I want you to observe is the hotspot of what I call the orange tower block of primary care prescribing. Primary care, pharmaceuticals, including GP prescriptions. This is this orange tower block there. Since 2012, there's been a year-on-year increase in prescribing. So this has just got more exaggerated. And this is the one we have a direct effect on. We can bring this down. There's another smaller tower block in primary care, acute and business services, but this is the prescribing one is the really crucial one. How are we going to reduce our impact on prescribing? Well, we're going to change from metered dose inhalers, or we're not going to prescribe in the first place. It's much easier to not prescribe in the first place than to have to go into deprescribing and have that conversation with patients. how I see this is that it's just crucial that we make the best decision, the easiest decision. At the moment, our prescribing, it's far easier to prescribe a drug than not to prescribe, because the culture is around, and the culture and the expectation is around that we will prescribe medication. And if we don't do that, we have to explain why we're not doing it and what else we might do instead. So we've got to gradually turn that juggernaut of cultural change around so that we are not expected to prescribe. And that's not the easiest thing. They make it harder for us to prescribe and easier for us to do other things that will benefit the patient. So just want you to bring this idea of sustainable clinical practice to you and look at some of the things that feed into this model of the outcome being the thing that we want to do is reduce carbon without reducing health. And we want to do that. We can do that by all kinds of different things, by practicing preventative care, by empowering patients to look after themselves and do things for themselves, but also to have pathways that are low in carbon or low carbon alternatives further down this thing here. But also we want to do less. We don't want to do masses and masses of tests, masses and masses of referrals, masses and masses of prescribing and admitting patients to hospital, because at every level, those all have a cost, a financial cost, a carbon cost, but also a workload cost for us. Thank you to, I just want to plug the Centre for Sustainable Healthcare in Oxford, because this is a slide from Frances Mortimer, who's one of the doctors in Oxford. They run really, really good courses on sustainable healthcare and SUSQI, which I'll mention in a minute, Sustainable QI Initiatives. So we're going to talk about the ways in which the things that we prescribe for patients, the things that we suggest to patients are good for patients, but also very good and have a very low environmental impact, very good for the planet. So we're going to, this is a visual from the BMJ a few years ago, looking at the various different things that we can do in primary care that also have a benefit to the environment, to the planet. And yes, I kind of think this is a sort of utopia vision, but it's okay to imagine utopia. And in fact, it's crucial to imagine utopia, to have the vision of where we can be, and to imagine how we would like to be, how we would like to practice medicine, how we would like to live our lives. I wouldn't be a proper Glastonbury doctor if I wasn't promoting this kind of book to you. Rob Hopkins, who's behind a lot of the transition town movement, from what is to what if. Apparently he's a very happy, content man. But also the permaculture movement, very, very much looking at how people and planet can live well and healthily. I'm sure I'm not saying the right words. Okay, so just I wanted to go into some of these co-benefits looking at health and climate. The first one, produced more, actually that's not the first one. The first one I wanted to go into, produce more renewable energy, looking at improved air quality, reduction in particulates. You may well find that in your area there is a solar street scheme run by the council. Really important to to see what's happening locally and to work with the other institutions. Second one, improving insulation in homes. Well, it's just, I mean, it's mad that these people, that we have to practice civil disobedience in order to get the government to insulate homes, to protect people. Some of you may know this lady. She's a GP near Bristol. She's been involved in quite a lot of civil protesting. But the other thing that we need to be promoting is active transport. It improves the outdoor air quality and improves people's health. So when I moved to Glastonbury from Frome, I've been working in Frome a long time, and I moved to Glastonbury and I started prescribing Hamwall. Hamwall is 3 miles from Glastonbury. And, you know, a rough count of the people who'd heard of Hamwall when I mentioned it was about 20%, maybe 10% of the people I mentioned it had heard of it, yet it was 3 miles away. And it's the most beautiful place. And it's flat, and there's free car parking, and it's a safe place to walk. So I started mentioning it to people, and there's a button you can click on Nhs called Map, and it gives you an overview of where the patient lives. And so I was able to see how far away the patient lived from Ham Wall, and I would suggest to some people that maybe they go and see it. And there was one lady who arrived on my list on lots of drugs I hadn't heard of, several of which were opiates, and I thought, well, I have to mention this straight away. So I said, you're on all these tablets. Ideally, we'd like to not have to prescribe these to you, but I realized it's going to be difficult. How else can we do? What can we do? And we looked at the options, and I noticed that she lived quite near Ham Wall. So I said, perhaps one of the things that might help is for you to be getting a dose of nature and going to visit Ham Wall. Maybe you could go and see what you think of it, and we'll speak again in the next week. And I spoke to her the following week, and she said, I went to Ham Wall, I walked there with my granddaughter and my daughter, and I walked back and I walked around. It was all very lovely, and I went to bed for 3 days. This is a lady with fibromyalgia and ME. Anyway, she has gone back to Ham Wall, and she is reducing her opiate medication. And it did make me smile, though, because I hadn't intended her to walk all the way and all the way back. But it's just, this is just a sort of reminder to have in mind the things to inspire people, because it's all very well saying, well, it'd be great to get out for a walk, and having vague sort of ideas, but actually to inspire people with a specific location and talk about the actual practicalities of going to the specific place is actually, I think, more enabling. We enable them better when we have those kind of conversations. So looking at other climate and health benefits, the next one is moving to a more plant-based diet and eating locally, although this has less impact than you'd realize, but the plant-based diet has a big impact. I would like to commend the papers written by Andrew Morris, who has developed some fantastic resources at Healthcare Mendit. And this one talks about the whole food diet, a whole food plant-based diet. And this is a very interesting slide. This is a slide, but I'll move myself so you can see the whole thing. There we are. This is a slide looking at health and environmental impacts of certain foods. So if the environmental impacts and the health impacts, environmental impacts are low and the health impacts are good, the food will have a very small plot around the center, a small inner circle. If the environmental impacts are bad and the health impacts are bad, then there's a big circle. So you can see the big circle at unprocessed red meat and processed red meat. It has a bad effect on a higher effect on total mortality, a high effect on coronary heart disease, colorectal cancer, diabetes, stroke. It produces a lot of greenhouse gas emissions, uses a lot of land, causes a lot of eutrophication, which is the production of algae and stuff in fresh water, acidification of the seas, and that's a specific measure looking at scarcity weighted water use, which you'll note nuts. I think it reflects the almonds in California. It's a very interesting thing, and this is a very interesting slide, I think, so that it shows that really the best things we can do are eat real vegetables, real fruits, nuts, and then legumes and vegetables to a certain extent. And we really want to be avoiding red meat and other meats. And SSBs is sugar sweetened beverages. They have a terrible terrible health impact. Although interesting, the environmental impact isn't measured very highly here. Why did I want to come back to sustainable practice? I think I wanted to talk about the sustainable healthcare, and then I wanted to tell you about SUSQI. So anyone doing a QI project, these people, the sustainable healthcare people in Oxford can suggest a project to you. They're really, really helpful. So, and sustainable QI projects really look at the outcomes for the patients and populations, but they also look at what they call the triple bottom line, which is the environmental impact, as well as the social impact and the financial impact. So it's just including that environmental impact in all of our assessments, in all of our decisions. The Greener Practice website is a very good resource run by three GPs in Sheffield. It's got huge amounts of really helpful, supportive resources. For example, they've got video room, waiting room videos, leaflets for giving patients when you're changing their inhalers, all kinds of things worth exploring. Now, this is the cover page for the Green Impact. You need to sign in, and then you can go through each of these indicators and work towards different levels of award. They have Bronze Award for doing the first year when you're getting ready for things and you're making small changes. And then the second year you can aim for the Silver Award, and then the final year, or actually no, you aim for the Gold Award, and then I think there's a Carbon Award after that. And they fall into different sectors: water, prescribing, travel and exercise, quality improvement, and zero carbon. I wanted to touch on green prescribing, which actually fits in to its way of reducing prescribing, reducing the impact of the prescribing, but also prescribing a dose of nature. So this is a very busy slide. It's just, oops, I've gone back, a busy slide looking at green care. Let's see what I was going to say about this. And really it falls into the prevention of disease, in that we should all be going for walks every day. We should be looking out of windows and making our lives as green as possible, in the sense of as much access to nature in our normal lives. But also we can be doing it using it as a therapy, green care as a therapy, encouraging people to go for walks as part of their health, mental health, their physical health, encouraging them to be in nature, to go swimming in lakes, in rivers, to get involved in gardening, to get involved in farming. All of these things have proven to improve health. And the evidence is there. doseofnature.org.uk. So I'm jumping around a little bit here, but this is part of the Green Impact for Health Toolkit, and there's quite a big section on social prescribing in there. And this is one of the things. Healthcare practitioners who have completed the training on social prescribing can show that they have formed a network with other practices to develop social prescriptions. Again, we don't want to prescribe drugs, we want to socially prescribe. Really, the goals are to keep people healthy, empower our communities, and improve individual well-being. For long-term conditions, some of the ideas and some of the things we've put into practice in Froome have been group consultations, peer support groups, but also empowering patients. We ran a Couch to 5K running group where we would meet once a week. And I mean we had a mental health nurse, me as a doctor, and a health coach meeting with the patients once a week, and we did the whole of the NHS Couch to 5K program with them. Very empowering and enjoyed by all of them. The Healthcare Mendip has got a fantastic website. I hope you're all using it, because a lot of the resources there are not location specific. This is some of the activity of the Health Connections Mendip group over the years since they formed, which was about 8 years ago. So they focus on mapping what's already in the area, about creating new groups, about signposting. Talking cafes became a very useful thing, in that it would be the first stop for people who wanted to get involved in something and didn't really know what was available. They were a regular meeting point for the health coaches and patients. And the Health Connections also made quite a lot of community inroads into other organisations who could maybe provide some support for some of the initiatives which the patients themselves might have, or the health coaches might have. It's all based on relationships, connecting, trust, doing what is best, seeing it as all, and everybody seeing it as their job, working together and listening and seeing opportunities. And I really feel like it's a sort of repairing society. From a doctor's point of view, it's about enabling the clinician, making the easiest, so that the best choice is the easiest choice. Now, this is more difficult to do because it's very, I wanted to use Q risk and statin prescribing as a sort of example of how the easiest thing shouldn't be to prescribe. So I developed a thing when someone had their cholesterol checked, I would check their Q risk, and there was a template letter we were supposed to send out saying your Q risk is over 10. We consider this entitles you to a statin here, and you can collect it from the pharmacy, and here's some information about it. And I thought, well, this is missing out the whole of the lifestyle opportunity. So I created an AccuRx template, which I put the prescription of a exercise, which is a lovely video called 23.5 hours on YouTube. I think it's about 6 minutes long. So I put the link to that video and explained, what a Q risk was, and then a link to the Q risk explanation. So that was the first thing that they might do. Of course, exercise isn't included in a Q risk calculation, but we know that exercise has a huge impact on the same risk factors for coronary heart disease and strokes. I also signposted the patients to the Health Connections website and the one-to-one health connectors, so that they might have a one-to-one goal setting session where they might look at some of the things in that they might be able to change. What I found really helped with me was following a sort of consultation framework. And I like Rangan Chatterjee's framework of the 4-pillar plan: relaxing, what we do to relax, what we eat, how we move, and how we sleep. But there are other models. And you will see, if you look on the Health Connections website, that the Human Givens psychotherapeutic framework has been developed to as a framework for assessing people. Within the Green Impact Toolkit are lots of things that are involved with empowering the patient, and one of them is the concept of shared decision making, introducing choice to the consultation, so that you describe the options and the patient can explore the preferences and make decisions. What are the benefits of this treatment? What are the risks? What are the alternatives, and what if we do nothing? I mean, this is something you can apply to so many situations, and it's empowering patients to be part of the decision making and being informed of the risk. Oh, Jack, she was a great success we had in the Couch to 5K that we ran in Frome. She was 68 when I met her, and she was walking with a stick and feeling old. She was on several repeat medications. She had diabetes and hypertension and chronic pain. She did our Couch to 5K course and became a very committed runner, despite always being at the back and always being the slowest. She did lots of scores on herself. She was quite interested in her medical state. I think she'd done a trial in the past, and she did a well-being scores, and it progressively went up, which was lovely, very gratifying. She managed to stop all her repeat medications listed there: tramadol, gabapentin, ramipril, and amlodipine. And she inspired her family, and she stopped needing to come to the GP, and she didn't need to go to the podiatry, which she had needed before because she couldn't reach her feet. She was it was a real pleasure to be part of her journey into better health, and she has given me the confidence that people can do this if we encourage them and maybe even tell her story. Well, this was just a quick mention about blue prescribing. This is a friend of mine and a patient who since died with his MND. when he was diagnosed with MND, he was an ultra runner, and he obviously couldn't continue running, but he became a swimmer, and he was going to cold water swimming with a team of people around him who supported him getting in the water, getting changed and swimming. And it was a really powerful thing for him and for his team, the relationships that he built in that by swimming. So we need to make this kind of thing easy. It's at the moment he was very able himself. He had a very competent and assertive wife who managed to really gets things organized. But how can we get more people who might not have the opportunities and abilities that he had to be beneficiaries of this kind of experience? So it's very quick. There's a very, very rushed tour, I'm afraid, through some elements of green or low carbon medicine. In summary, we need to reach net zero as soon as possible. The goal that the NHS have set themselves is 2040, and we can do that by directly influencing our patients, by changing their medication, reducing their medication, but by practicing a more preventative, more patient-centered and less medicalized practice of clinical medicine. Please look up SUSQI, make sure your project's a SUSQI. Look around, what is the local place in your area where there's a nice flat walk that people can do in a beautiful place, which will enhance them. Have you got a park run locally? There's also an initiative to become a park run practice, which I didn't talk about. And please link in with your social prescribers. And if there's something you think they should be offering, talk to them about it, and they're likely they'll help. You can set up something together. Look at different ways of consulting that perhaps can consider more holistic lifestyle approach, and start doing group consultations. Group consultations are a great for long-term conditions and for things that involve changes in lifestyle. Thank you very much. Oh, and there's some more take-home messages. Sign up for Green Impact, form a network. If you don't know a network, write to me and I'll join you, link you in with the Bristol one. Innovate with your social prescribers, optimize asthma care, make your QI project a SUSQI, and start doing group consultations. Thank you very much. And there's some links. I would suggest you go to that one at the bottom, the Terry Kemple video, so that you can get a bit more in-depth knowledge about the Green Impact. Thank you very much.